So I think this particular subtype historically has been quite aggressive, but also quite rare. And so I think there's been, a need to know more about this particular subtype that's been really elusive before because of it's just its general rarity. So I think with these new large data sets available, this provides an opportunity to really understand more. In particular, really see if there's any features of these subtypes that might be different than kind of the more predominant subtypes, and if there's any existing therapies, for example, that might be good for these particular subtypes. So that was a primary motivation for sure. So this was certainly a retrospective cohort study um, of really the pancreatic tumors that have been submitted to Caris Life Sciences and analyzed as such. Um, of all the over 5,000 tumors that are in this data set, 20 were confirmed by pathology and histopathology to be this USC subtype, which is the largest to date. So we used next generation sequencing and whole exome sequencing on a variety of kind of gene panels that we have kind of as standard. And then analyze, in addition, the tumor microenvironment components in various ways of these particular tumors compared to kind of the larger data set as well. So, for example, we looked at immune cell fractions, we looked at microsatellite instability, mutational burden, and then we also looked at PD-L1 and PD-1 status of these particular tumors because we have therapies that target these, of course. And so I think the most striking thing of everything that we found was that PD-L1 expression in particular was significantly increased in this USC population, 63% versus 16% in the non-USC population. And I think that, in traditional PDAC, that these immune checkpoint inhibitors have not really been shown historically to be effective, but no one has really looked in this way at this particular subtype. So for us, it's an exciting avenue that maybe there's this, these pre-existing therapies that might work for this particular subtype. And I think that, remains to be explored. But I think because of this expression, maybe this is a feature that can be targeted in this particular subtype. So the first one, the PD-CD1-LG2, is also known as PD2, or it's the gene that expresses, just like how we have PD1, we have PD2, and or PDL2, I should say, not PD2, PDL2. And this is, a component that binds PD1. So, for example, if you maybe block PD1 via the drugs we have available, then maybe this would be an effective strategy as well. In terms of the PD-CD1, that's the gene that expresses PD-1, so kind of in a similar fashion, again, using our pre-existing immune checkpoint inhibitors. And then this HAV-CR2 expresses also this protein called TIM3, and this is a marker on CD8 T cells. And this, the role of this is kind of varied, but it suppresses the macrophage activation in particular. Following PD-1 inhibition. So this is another kind of immune suppressor, if you will, that is being targeted and is an active area of drug discovery and exploration. So that only trended towards significance, I will say that. So there's kind of an asterisk with that. But I think all of these are just really showing that maybe there's some different immunological features of these particular subtype of tumors that therapies that target immune checkpoints in various ways might be effective, whereas historically non-USC subtypes it's not been as successful. I mean, I think the significance and excitement around the fact that this PD-L1 expression is has elevated expression in our analysis is that is that we have, therapies that block the PD-L1, PD-1 axis. The question I think will become, is this a correlation where we just see this expression, but it's not maybe as clinically meaningful? Or is this potentially, maybe a major driver of how these tumors get so aggressive? And maybe if we were to target this therapy, we could see, efficacy and success. And so I still think that question remains to be explored, but I think to this point that was, really not known, and I think there's always excitement for personalized treatment in these particular tumors as well. Certainly, I think there's a lot of questions this study opened up. In particular, even though we looked at 20 different, or we had an N of 20 of the USC subtype of this tumor, it's still quite a small number. And as kind of I mentioned before, there was some targets that, for example, trended towards significance, but maybe we just need more data. So I think we'll continue to collect tumors and kind of analyze them and see if there's any differences in that way. But I think on the flip side is that, this is all retrospective data, so I think this is a really interesting time to have some prospective data. So what I think would be an interesting next step would be to see some prospective data with these PD-1, PD-L1 inhibitors or immune checkpoint inhibitors to see if there's any effect, even in, small sample sizes, to see if this really is borne out or really to test this hypothesis. So I'm excited to see where that goes, and maybe we'll have an answer one day.